Question 41. A terminally ill resident, Sean Castillo, visits with his family. He discusses with his funeral arrangements with them. He lets them know that he is concerned about their well-being after he is gone. He says he wants to spend as much time as possible with them before he dies. Mr. Castillo is going through the stage of grief: A. Anger, B. Bargaining, C. Acceptance, D. Denial. Answer C. Explanation. The five stages of grief in dying are a model of that explains the emotional response to death. Both the client and the client's loved ones can experience these emotions. The stages are denial, anger, bargaining, depression, and acceptance. The stages are not linear. Most people move back and forth. Acceptance is the final stage. When the client reflects on their life and understands that it is ending, they feel at peace and want to share their time with loved ones. Question 42. Mr. Schwartz is concerned about his son and asks to speak to his rabbi. The nurse should A. Report Mr. Schwartz's concern and request to his family. B. Ask the nurse to contact Mr. Schwartz's rabbi and invite him to visit. C. Assure Mr. Schwartz his son is going to be fine and not to worry. D. Ask the nurse if Rabbit is allowed to visit in the facility. Answer B. Explanation. Every client has different religious needs. When a client requests to speak with their rabbi, pastor, imam, or other leader, the nurse should help arrange the visit. Notify the nurse or social worker who can contact the clergy. Spiritual care can be as important as physical care. Question 43. Delusions is defined as A. Invalid sensory information within the brain. B. Reactions after natural catastrophes. C. Depression caused by ongoing heavy rainstorms. D. False beliefs based on misinterpretations. Answer D. Explanation. Delusions are false beliefs that involve a misinterpretation of experiences. A person may believe that they are being followed, tricked, or spied on. They may also be convinced that songs or books contain special information meant for them. Attempts to show the patient that their belief is wrong or irrational are not accepted by the person. Question 44. Depression is a common mental disorder. Which symptom is often associated with it? A. Laughing hysterically. B. Having extra energy. C. Sad or hopeless feelings. D. Feeling upbeat all day. Answer C. Explanation. Depression has several symptoms that signal the need for treatment. Sleep problems can be a significant sign, either too much or too little. Other symptoms include feeling sad or hopeless, difficulty concentrating and making decisions, irritability, loss of interest in favorite activities, weight gain or loss, or even thoughts of suicide. Question 45. A patient with stage 4 lung cancer has not been eating or sleeping well and has lost interest in activities. These behaviors may indicate A. Acceptance, B. Anger, C. Depression, D. Denial. Answer C. Explanation. The five stages of grief and dying are the model that explain the emotional response to death. Both the client and the client's loved ones can experience these emotions. The stages are denial, anger, bargaining, depression, and acceptance. Depression serves as the beginning of the client's understanding that they are going to die. It is also called preparatory grieving, as the client feels sadness, fear, and uncertainty about what is ahead. Question 46. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to A. Show the resident that the nurse aide is in control. B. Explain that if the resident continues, a restraint may be applied. C. Step back to protect self from harm while speaking in a calm manner. D. Call for help to make sure there are witnesses. Answer C. Explanation. Combativeness is usually more than fatigue. It can also be a sign of confusion, depression, or fatigue. If it happens in late afternoon, it can be a sign of sundowner's syndrome. Stay out of the way to avoid getting hit and speak in a calm voice. Try to redirect the resident to another activity or offer to go for a walk to help them relax. Be patient and go slowly. Question 47. The nurse aide is caring for a client who is agitated. The nurse aide should A. Ask to be reassigned to another client. B. Tell the client to be quiet or they won't get dessert at dinner. C. Talk in a calm and reassuring manner. D. Speak loudly so the client can hear the instructions. Answer C. Explanation. When a client is agitated or frustrated, do not elevate their situation by raising your voice, arguing with, or ignoring the client. Speak in a calm and reassuring voice and try to find out what is causing the client's behavior. Listen to their frustration, offer a favorite object, or go for a walk. Look to see if there is something in the environment that triggers the agitation. Loud noises, open spaces, unfamiliar people, fatigue, hunger, or need to use the toilet. Over time, you may recognize warning signs of agitation and be able to intervene quickly. Question 48. A rehabilitation patient is experiencing anger, depression, and hostility. What action should the CNA take? A. Leave the patient alone to resolve personal feelings. B. Provide support and realistic reassurance. C. Tell the patient they must work harder in therapy. D. Remind them that they will never be totally independent again. Answer B. Explanation. Loss from independence or a life change triggers the same grief experience as a death. In rehabilitation, a patient faces rebuilding their life after an injury or illness. Progress can be slow and frustrating. Provide support and compassion for the patient, but use honesty when offering reassurance. Do not give false hope or promises. Question 49. Sexual desire and activity in the elderly. A is non existent. B should not be encouraged. C may be a natural act. D stops by age 80. Answer C. Explanation. Humans can remain sexual throughout their lives. If residents are mentally competent, they can decide to seek intimacy. Residents have a right to express their sexuality as long as it is not public and does not harm the resident or others. Assure privacy for residents and avoid commenting to co-workers. Always treat residents with respect and dignity. Question 50. A client's psychological needs A. Are reinforced by doing everything for the client. B. Are nurtured when clients are treated like individuals. C. Should be given minor consideration. D. Make the clients become withdrawn and secretive. Answer B. Explanation. Care for clients should include both health and psychological needs. Clients who are ill feel stressed and anxious. They require support and understanding from their care providers. Each client has a unique situation and unique needs in order to successfully cope. The CNA should take time to learn about each client and how to respond to their individual counter experience.
Thank you for watching.